Hi, my name is Hector Novas. Chapter 14 Symptoms and Signs. The screening problem. The problem which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as finding on examining the patient, for example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaint. To report a patient's symptoms or complaint, doctors say, Mr. Farwood was at what at me complaining of chest pain. In case no, the abbreviation CO is U chest pain. V presentation. Patients say Patients say they went to see doctor. Doctors say the patient present. The symptoms which causes a patient to visit a doctor or to present is called the present day symptom, presenting, complete, or presentation. His presenting symptoms was chest pain. We present to his GP hip chest pain. Visual presentation is chest pain. C. Talking about symptoms. Symptoms many patients say. Um, Tiredness, uh, lethargy, fatigue, lassitude, loss, loss of energy, um, I feel tired all the time. I feel completely worn out. I live I if be feeling completely exhausted at the end of the day. Malaria, general feeling of being unwell. I've been feeling of color for 2 days. Anorexia, loss of appetite, loss of appetite. Many appetite is very poor, and weight gain increases in weight. I've put on 8 kilo in the last year. Weight loss decreases in weight. I'm not eating any less than usual, but I've I love a lot of weight recently. Con- Constipation, heart, infrequent feces. I've I've been quite constipated lately. 14.1. Complete the table which word from C or positive. Put a stress mark in front of the stress syllable in the H word. The first one has been done for you. Noun and adjective. Exhaustion, exhaustion. Fatty, fatigue. Lethargy, lethargy. Tiredness, tiredness. Perdón, tired. 14.2. Make make word combination using a word from H bots. Complete of color. Out of shorts. Present with. Put on. Word out. 14.3. Complete the sentence with the correct form of the verb present. As 16, 7-year-old man present with a 9-month history of increasing shortness of breath. 2. The most common presentation is loss of consciousness. 3. Cranial arteries may present as fever without any obvious causes. 4. The patient usually present with several sore throat. 5. The present symptoms in this patient could perhaps be due to renal failure. Other Other conditions with a similar presentation include cholecystitis. 7. 7. Reduced growth is an important percentage completing of coeliac disease. A. Two months following presentation, the patient was able to walk. 14.4. Read the patient description of her symptoms, then complete the case report. I, I, I was, I was well until the few months ago. In the beginning, I just feel off color and being tired, but later I've been feeling completely worn out at the end of the day, and not eating any more than usual, but I've put on 9 kilo in the last year. My motion are hard and my hair has started to fall out. Um, case 13. a 15-year of house uh, wife who had been held until 4 months previously complaining of tenderness and malaise. She had um, gained 9 kilograms in weight in the year before she presented to her GP, although she didn't increase more than usual. She was constipated and she noticed that her her hair had started to to fall out. Chapter 15. 15.1. Find word in the box with opposite meaning. Acquaint, inacquaint. Ahead, for. Insudace, sudden. Likely, unlikely. Sever, mild. Rare, common. Um, 15.2. May word combination using a go from H bots. Bone marrow. Deficiency diagnosis is easy easy issue days onset. Iron deficient deficiency. Um, Pernicious anemia. Progressively increasing. Vibration sensor. Um, 15.3. Complete tenses. 1. A 39 years old may present with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by vitamin A deficiency. Deficiency. 3. The blending and purpura are caused by abdominal and platelet fusion. 4. The white the white cell count is normal, so we can exclude acute leukemia. 5. The yellow the yellow color of hair, aching at conjunctiva is probably due to goiding. 6. There was a palpable mass in the right upper quadrant of the abdomen. 7. Attractment is imminent at restoring fluid bulk with adequate intravenous fluids. A. The anemia may be due to increased red cell break- breakdown. 15.4. Complete the conversation. Professor, what is and hate the diagnosis of pernicious anemia on physical examination? Student, the problem starts quite suddenly, so it descends have the typical insidious onset. He doesn't have any skin pallor and he doesn't have symmetrical parentheses or a set vi- vibration sentence. And A couldn't feel his explain. Professor, what about his tonguehead? Student, his tonguehead was normal and not inflamed or sore. Chapter 16. Bones. A bones. Some common English names for bones. English name, anatomical name. Skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, and patella, shin bone, tibia. V. Fracture. A fracture is a break in a bone. Some of the different types of fracture. Green, green stick displays, communicated, impacted, open compound. A pathology fracture is a fracture in a diseased bone. A fatigue or stress fracture is due to rapid minor trauma. And for example, long distance marching or running. C. And trauma of fracture. When the fragment of a broken, unheld, and joined together, they unit. Uh, union may be promoted or held by reducing the fracture, replacing the fragments in their anatomical position if they are displayed. After a reduction, excessive movement of the broken Bone is prevented by fixation, either external, for example, a spleen or plaster for Paris cats, or internal, for example, a pin or a pit, and screws. A display fracture which is not reduced may result in malunion, incom- incomplete, incomplete or incorrect unit. Um, Note, the verb reduce has several meanings in medicine. To make a smaller a thick with better reduce the dose of your tables. In surgery, to return to anatomical position, a hernia can normally be reduced by manipulation. In, in chestmetry, to remove oxygen or a hydrogen nitric acid is a reducing agent. A plaster, a plaster cut, a pin, a plate in scripts. And 16.1. Label the diagram using word from the box. Scalp, jawbone, spine, breastbone, rib, collarbone, shoulder blade, thigh, bone, kneecaps, thigh bone. 16.2. Match the types of fracture with the description. 1. Open A. There is break in the skill. 2. Communicated. C. The ball is broken into several pieces. 3. Displays V. The bone is bent. It cause, no, is occurs mainly in children. 4. Green stick D. The broken pieces are separated. Separate. 5. Impacted E. The broken pieces are pushed together. Um, 16.3. Complete the textbook extract. Reducing a fracture involves and trying to return the bones to as near to their original position as possible. If a fracture is lodged together in a displaced position, the fracture will unit, but it may go on to malunion. Chapter 17. 17.1. Complete the table with words from A and C opposite. Then complete the sentence with words from the table. Verb, nouns, adjective. Um, delayed. Development, develop. Distant, distinction, distended. Fail, failure, failing. Nourish, nourishment, nourishment, nourish, nourishment, nourished. One, babies with the fetal alcohol syndrome, may process with failure to thrive. Two, abdominal distension may be due to an enlarged liver. Three, a small amount of alcohol in pregnancies can affect fetal development. Four, mortality from from measles can be reduced by better nutrition. Five, and display in one or more of the milest- milestone may be the first sign of disease. 17.2. Complete the sentence. After one, and after searing, babies learns to crawl and then to walk. Two, a child who have started eating and solid food has been weaned. Three, someone who is not very tall is said to be of short stature. 4. The stage in a child's development are known as the millenniums. 5. A child who is beginning to develop sexually has reached puberty. 17.3. Greet the common English name for age disease using your medical knowledge. 1. Enlarged parotid gland uh, mumps. 2. Difficulty opening the mouth lockjaw. 3. Um, rush, rush in enlarged posterior occipital nose German measles. 4. Porosia small, cowish, and vomiting, whooping core. 5. Papule and vesicle and, vesicle. First on truck and she can chicken pox. 6. Co and cold followed follow followed by rush measles. 7. Sore throat in rush scarlet fever. A. Swallowed joints and a hard murmur re, rheumatic fever. 9. Fever followed by muscle weakness, pulse. 10. COVID streeter crow. Chapter 18. 18.1. Complete the table with word from A, B, and C opposite and relaxed forms. Put a stress marker in front of the stresses syllable in each word. The first one has been done for you. And verb now. Inhibit, inhibition. Produce, production. And releases, relax. Replace, replacement. And serute, sec- secretion. Stimulate, stimulation. Um, 17.2. Complete the passes from a textbook using the illustration and your own knowledge. Pool of GnRH and gonadotropin relaxing hormone are released from from the hypothalamus and stimulate LH and FSH release from the pituitary. LH stimulate testosterone production for Ehrlich cells of the testing and testosterone feels back on the hypothalamus hypothalary to inhibit GnRH recreation. FSH triggers the Sertoli cells in the semiferous um, tables to produce mature sperm and the inhibin A and V. Inhibin causes feedback on the pituitary to decrease FSH secretion. And 8.3 completed the sentence. 1. A diffuse, a diffuse change affects many parts of an organ or or gland. 2. Allocalia, allocally, allocally change affects only one part. 3. He is deficient in iron. He doesn't have enough iron. 4. SST3 and T4 increase the basal metabolic rate. Um, 18.4. MASH, Mr. Davis, symptom which the question her doctor asked. 1. Diarrhea. Z. Are your bowel normal? 2. Urine. 2. Perdón. Excuse me. 2. Urine more. C. What is your appetite like? 3. Head intolerant. A. Do you um, prefer prefer God gather or cold? 4. Uh, Overactivity. E. Are you able to sit and relax? 5. Um, Palpitation. G. Have you ever feels your heart beating rapidly or irregular? 6. Weight loss. V. Is your weight steady? 7. Tremor. F. Do your head shake? Chapter 19. The eyes. A. Part of the eyes. Eyebrow, eyelashes, pupil, iris, eyelid. V. Examination of the eyes. There is a extract from a textbook description of, of how to examine the eyes. Look for seek, seeking strabismus, dropping of the upper lid, dosing of oscillation of the eyes, nystagmus. In lid lag, the upper eyelid move irregularly instead of smoothly uh, when the patient is asked to look down. Next, examine the pupils and know heather and know whether, excuse me, they are equal. They are equal inside. They are they are regular in outline, everly circular. They are abnormally Delay large on country small. They react normally to light and accommodation focus on night objects. To test the reaction to accommodation, as ask the patient to look into the distance. Goal, goal your finger in front of their nose and ask the patient to look at it. The eyes should come together or convert, and the people should country as the patient the patient look the patient looks at the finger. Check also for cataract opacity of the lens. C. Retinopathy. Hypertensive change in the retina can be classified from grades 1 to 4. Grade 1 silver weaving increase in la light reflect of the arteries only. Grade 2 grade 1 plus arteriovenous pinning in the tension of veins where they are crossed by arteries. Grade 3 grade 2 blues flame shape hemorrhage and cottonwool exudate. exudate. Grain 4 grain 3 plus papillodema and cotton etc. Cottonwool etc. 19.1 Complete textbook with word from the opposite and, and relate from verb, noun, and adjectives. Accommodate, accommodation. Constrict, constriction, constriction. Uh, Converged, convergence. Delayed, dilation, delayed. Drop, dropping. Oscillate, oscillation. Right, ration. And 9.2 match the pictures with the condition. A. Dropping of leaves, seeds. V. Delayed pupils, 3. C. Irregular pupil, 2. D. Cataracts, 5. E. Skin 1. A. Country pupils. 4. 19.2.3, excuse me. Complete the strap from a textbook. Retinoscopy. Examine the retina with an ophthalmoscopy if possible with the pupil delayed to obtain the maximum view. Look for papilloma and four-flanked shape. Uh, Omoreas and copule excedes. Assess the space of the arteries and note the presence of any narrowing, as well as nipping at arteriovenous and processing. Chapter 20. The gastrointestinal system. A. Examination of abdomen. Here is the extract from a textbook description of how to examine the abdomen. Note, if the abdomen is distended by fluid organs, the presence of fluid can be confirmed by the by demonstrating shifting dullness. Percon or tap hairs weight the patient limes and supine flat on their back. There ask the patient to lie on one side the parallel again. If fluid is present, the cold nod her on percussion move. Pal- palpation each region, feeling for tenderness, pain when touched or masses. Pal- Palpable enlargement of tissue, not also any wording or the shown by contraction of the abdominal muscles. Wording may be due to ten, tenderness or anxiety, anxiety and can be reduced. Reduced is the patient is persuaded to relax. And rigidity, however, is content and at ease due to periodontal irritation. Reboot reboot tenderness is pain when the palpating Head is suddenly removed. It is sign of period, periodontality, leads for vowel sounds. V. The V. The feces. There are several words from the feces. Doctors sometimes say there was blood in the stalls. Have have you passed black cold? Patient sometimes say my motion have been very lost lately. Bowel movement is is used to refer to the defecation. Have your bowels moving today? Have your head a bowel moving today? Bowel, bowel habit is a medical expression meaning the pattern of defecation. How you notice any check of bowel bite? How often do you open your bowel? Are you going to toilet more often than normal? Um, change in change in will habit could be constipation, heart infrequent stalls or diarrhea, frequent soft or or liquid stalls. Normal stalls are bone in color and semi-solid or formed. Their consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, uh, soft, lost, liquids, watery. The color, the color the color que vary from black due to alter blood is the melania to to yellow, gray, or even white. Melania stalls are often described as the asteroid like tars, the back stick substance that is isn't in raw, making the stalls may be red when fresh bug is present. Blood that can only be detected with a special that is called called a cold bug. FOB when there is height when is height had contact the stalls are pale and are sometimes described as clay colored stools that are large in volume are described as bulky. A bad smell is described as foul or or offensive. 20.2. Complete the Kane's report. Kane, Kane 14. Physical examination revealed a thin hair with a slight polar. She was not obviously the height. The temperature was 38 degrees Celsius pulse, one Gondre mean, blood pressure 118, examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distant. There was generalized quadrant, which was most marked in the right lower um, ri- rigidity and was associated with masses but not tenderness. There was no rebound wording and no tenderness. Tenderness when felt, um, vowel sounds were reduced. 20.2. Match the description of the stores with this condition most like most like most likely to cause them using your medical knowledge. A type of stools and condition. 1. Low bloody. C. Ulcerative colitis. 2. Low bell bulking. E. Coelic disease. 3. Clay color. Clay color. Clay colored. F. Abruptly jaundice. 4. Black Terry. A. Gastric ulcers. 5. Small heart. V. Irritable bowel syndrome. 6. Clears and wet clears water with mucus. D. Cholera. 20.3. Must the features to the doctor question. 1. Blood. F. Have you passed black stools? 2. Um, Bowels habit. A. How often do you open your bowels? 3. Chin in bowel habit. V. Are you going to the toilet more often than normal? 4. Book. G. Is the size or The amount of the stool normal? 5. Go, eat. What about the appearance of the stools? 6. Consistency. C. Are the motions hard or loose? 7. Offensives. D. Do the motions have a unusual angle? Chapter 21.1 with a simple English phrases for each of medical terms below using your medical knowledge. 1. Hysterotomy, surgical removal of the womb. 2. Memoria, having peers. 3. Salpingitis, inflammation of one tubes that connect the ovary to the womb. 4. Cervical biopsy, of small pieces of tissue removed from the neck of the womb. And 21.2. Read the conversation be, uh, between the gynecology, and the patient. And menarches, 12 years. Menstrual cycle for 528. LMP 150 to ago. Menorrhea, no. Dysnorrhea, no. Discharge, uh, a little a little whitey discharge in between periods. 21.3. Now growing now write the question that the doctor asked. And Nenarch, Nenarch, how, Nenarch, how old were you when you start to head then your periods, periods, menstrual cycle? Are you are you period regular? LP, LMP. When was your last period? Menorrhea. Well, you see, they are eyed over giving dysmorphia. Do you have period pains? Discharge. Is there any discharge between the periods? 21.4. Complete the case reports. K15. A 45 years old Wehrman had behaving prolonged periods lasting for 8 days with passages the passages of blood For 9 months. There was no blending be- between periods of after intercourse. Her period were not particularly painful. She had not noticed any 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 hot flushes or night sweats, and her general had always been been good. She had taken the oral cons- contraceptive contraceptive pill until a year previously, when Cooper Coy was fired. She had a normal pregnancy when she was 25, and diaphragm, UD, condoms, Cooper coil. Chapter 22, 22.1. Complete the conversation based on the key history in the opposite. Doctor, what seems to be the problem? Patient, I've been hearing palpitation. Doctor, how long had you had 10? Patient, for about 6 months, but I've had heard problem for years with tiredness and shortness of brain. In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 kilos. I got a mitral valve replacement 3 years ago, and that improved things for a guild. 22.2. Make words combination using a word from age, but to word can be is twice. Add threats, atrial fibrillation, cardiac output, out, output, heart failure, on effort, period, or edema, premature beats. 22.3. Why the word a patient word is used to describe the symptoms below. 1. Dyspnea, shortness of breath. 2. Rhythmia, palpitation. 3. Orthonia, breathlessness when Leon flats. 4. Oedema as will. 20.4 complete the K reports. K13 K13 a 16-year-old woman attend where GPs and surgery complaining of breathlessness of exercise. This had been increasing over the previous 8 months until it was producing problems at around 5 and 100 meter walking of the level. There was no history of chest pain. She had had several um, at- attacks of heart palpitation, which lasted 20 at 30 minutes and when associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. This decided this decided overnight. Chapter 23 23.1 complete the table with word from A opposite. Verb noun auscultate auscultation. Examination. Inspection. Pal- palpitation. Percussion. 23.1.2 excuse me. Put the steps for examining the heart and circulation in order according to the four-stage system. 1. D. Look for clogging inspection. 2. C. Feel the radial pulse palpitation. 3. E. Focate the apex beats palpitation. 4. F. Nori, norit, norit and any thrills palpitation. 5. A. Measure the heart side percussion. 6. B. Are there any normal auscultation? And 23.3. A doctor is presenting the case of 43 years old woman at a meeting in the cardiology department. On examination, she was hypertensive with a temperature of 38.5. She was shown off breath. Her pulse was variable between was 100 and 100 and 80 and was irregular in time at form. Help blood pressure was 130 18 and her GDP was up 5 centimeters and show, showing normal movement with respiration. Her peripheral pulse were at present and there was not central or peripheral cyanosis. Her apparent beat was displaced to the and anterior auxiliary lines, but stayed in the feet intercostal space. Her heart sounds was very interesting. When she was initially examined, it was noted that she had pansystole and mid dystole. Murmurs her best at the apex. When she was examined, home, home over layers there was also pericardial friction rub all over seprocardium or diagnosis at that Tanya Goat of mutual stereosis and incomplete which arrested onset of pes, of pecaldris and atrial fibrillation. Chapter 24 24.1 match the two part of the sentence. 1. 1988 saw the United Kingdom launch of live attenuate G. Miss Missless Mont Erubella MNR vaccine. 2. Chicken pox varicella is a common infection. E. The size of childhood. 3. Um, previous as an incubation. A. Period ranging for from 4 days to many months. 4. The patient remained febrile. Age with pins of temperature for 39.5 grade Celsius. 5. He was admitted with a 4 day history of influenza type symptoms of fever with V rigors mild agia and general malaise. 6. Quite a portion of patients who recovered from hepatitis V. C. Become curious carriers of the virus. 7. The central part of Africa is in the midst of an epidemic F of AIDS. 8. Measles rubella is mod. D. Infections during the catarrhal state. 9. Lyme disease is caused by transmission G of the burdofery from animal to man by oxytics. 10. PU, PUO stands for I. And Pyrexia of unknown origin. And 24.1. Complete the case reports on the patient in a opposite. Case 45. On examination, he on examination he looked on wall. His pool rate was 100 minutes. He had a papa spleen. The combination of fever and rigor in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The coverage, the incubation period is usually 10 at 14 days. In this case, the patient admit he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of paresis in his blood blood film. 24.3. Complete the sentence. 1. A infection with can be treated successfully with antibiotic is curable. 2. Another word for a pandemic is an outbreak. 3. Bacteria and bacteria and viruses are example of microorganisms. 4. Someone whose temperature is normal is a period serial. 5. The common infection with Spain barbarus is known as glandular fever.